Hey Dragon Slayers, today's video is about gestational diabetes, preeclampsia, and their connection to insulin resistance. The most obvious reproduction related disorder with insulin resistance in women is gestational diabetes. This happens when the woman becomes sufficiently insulin resistant during the course of her pregnancy that her insulin is not enough to keep blood glucose at normal levels. At this point, the normal physiological insulin resistance has become pathological. The fine line between these two states is glucose control. Gestational diabetes can happen to any pregnant woman, though the usual risk factors that apply to insulin resistance are the most relevant. We'll get into risk factors in more detail in part two, but for gestational diabetes, they include pre pregnancy body weight, age, family history of diabetes, ethnicity, with those of Asian, Hispanic, or Middle Eastern descent having the highest risk. They're all ethnicities with greater risk of insulin resistance. Unfortunately, even with the women who had no evidence of insulin resistance or type 2 diabetes before pregnancy, developing gestational diabetes increases her likelihood of developing type 2 diabetes later in life. In fact, on average, her risk of developing type 2 diabetes is 7 times higher when compared with women who did not have gestational diabetes during pregnancy. Preeclampsia is a more severe insulin resistance during pregnancy, which usually manifests as gestational diabetes, increases the risk of developing one of the most lethal pregnancy disorders, which is preeclampsia, a dangerous change in kidney function. Women who develop more dramatic insulin resistance during early pregnancy are significantly more likely to develop preeclampsia during the second half. The connection between the two disorders is not fully understood, but it very likely has to deal with at least some sort of blood pressure problems that arise from insulin resistance, including activation of the sympathetic nervous system and reduced nitric oxide production. However, it may happen the altered blood pressure with insulin resistance creates a situation where blood flow to tissues in the mother, including the placenta, is less than ideal. When it's not getting enough blood, the placenta creates a signal protein called vascular endothelial growth factor. We'll just call it VEGF for short. For itself and the rest of the body, VEGF stimulates the formation of blood vessels, and in releasing this protein, the placenta is trying to increase the amount of blood that it receives. In a healthy pregnancy, this is exactly what happens. The placenta needs more blood, and VEGF helps that happen. But in the case of preeclampsia, the placenta inexplicably releases a second protein called the soluble VEGF receptor, which sticks to VEGF and prevents it from working. So, even though the placenta is making VEGF, the protein can't do anything. Not only does this scenario hurt the placenta by not letting it create new blood vessels, but the kidneys suffer a serious setback. They need the VEGF that the placenta makes. The kidneys normally use VEGF to maintain normal blood filtration, which is their main job and absolutely necessary for health. When the kidneys don't get enough VEGF, they start to lose their functionality. They stop filtering properly, and the toxins and excess water start to accumulate in the blood. Higher blood volume via excess water is the main cause of increased blood pressure, as we saw in chapter 2. But the toxins are more dangerous and more of a problematic feature, potentially leading to seizures and death as they affect the brain. Meanwhile, the kidneys lack VEGF, so also causing them to become leaky, allowing protein from the blood to spill into the urine. This is why we monitor not only blood pressure of women with preeclampsia, but also the amount of urinary protein as an indicator of kidney health. If isn't caught early and treated, preeclampsia can lead to liver or kidney failure and future heart diseases for the mother. For the baby, less blood flow to the placenta means the fetus gets less food and oxygen, leading to lower than normal birth weight. The only real solution for preeclampsia is to remove the placenta, which means removing the baby as soon as it's developed enough to deliver safely. That means including inducing labor or a very, very early C section to protect the mother's health. That's what I've got for you guys today. Don't forget to like and subscribe because it really helps the channel out. And remember, guys, that together, you and I will slay the dreaded diabetes dragon.